Hello everyone, my name is Fawaz. Today we have cleaned the area and sterilized the area. We have our blue cover underneath. We have prepared our equipment and got them ready. And then now I'm back in my sterile gown, sterile glove, and maximum sterile precaution. In this video, we'll be talking about how to drape our patient and how to get our equipment ready for the central venous access. So we have our drape on our side. So we're just going to grab it here. So we're going to move the white cover covering the adhesive part. You can get rid of this part. So just to note, we have labels pointing to where the direction of the head would be. So how we're going to proceed is that we're going to flip this over. And the most important thing is that we're going to bend this and place it over our target area without our fingers touching the patient. So can you turn your head to the left? Okay, place it firmly, and then what you're going to do is that we're going to follow the direction of the arrows. So this is pointing toward the left, so we're going to move it to the left side. This is moving to the right, we're going to move it to the right. And the top arrow is pointing toward me, so we're going to cover the head. We're going to move the bottom part.
Just watch your trachea.
Okay. And then we can have our assistant helping us over where they can grab the corner and drag it away from us. All right, now that we have the blue cover on, we just need to make sure our target is at sight. And so adjust the circle to where you have cleaned, making sure that there is no clothing material, no plastic in our way. So now that we are happy with our site, we can discard this part. Make sure our sterile fields and continue with our sterile workspace and get ready for the next part. Now, because we're going to need ultrasound for this procedure, we need to cover the ultrasound in a sterile fashion. So we have our sterile cover over here. We're just going to open it up, and our assistant will have things ready. So just to show you what's inside, you have your gel, you have 2 rubber bands, and you have the sterile cover. So have your rubber bands in a position that you can easily grab. And what you're going to do is that you're going to move your hand all the way inside. And this is, you can do it in 2 ways. You can have your assistant put some gel on the ultrasound, or what you can do is that you can grab the ultrasound, open it up, and place it inside. Now you're ready to grab the probe. And then you're going to grab the edge. Cover it all the way down, and then have your assistant grab the edge. Now, this is where the rubber bands come into play. So you'll grab the first one and make a tight seal. Now, make sure that you keep it a tight fit and move all the gel to the top part. The next step is that you'll grab the second rubber band and move it all the way down, midway or so. Now, very, very importantly is that when you place this down, you want to place it in such a way that it doesn't drop on the floor, okay? The last thing you want to have it is place it on an edge and it drops on the ground. Number 1, you damage the probe. Number 2, you have to start all over. So I'm just going to place this down now.